Mr. Speaker, my question is for the Minister of Health. Minister, last year I raised the issue of access to medical laboratory services throughout my riding. Lab closures in Stayner and Elmville were having negative impacts on seniors who endured long lineups, extra costs for parking, and up to $80 to travel to get their blood taken because their local lab was closed. At that time, you said that you were working to resolve the issue of access to lab services. Minister, the lab in Elmville is still closed, and it's not clear that the Stayner lab will stay open in perpetuity. So I'm not sure what you've been working on, so I'm going to ask you, what have you done to ensure that seniors in my riding have access to lab services?
Speaker, thank you, and thanks to the member opposite for this question. It is one that is of concern to me, and I'm very happy that the Stayner lab is open, Speaker. This is, when we're talking about improving access to care, these community labs are part of that care that people need to rely on. We're asking people with diabetes, for example, to have the testing they need done at the appropriate intervals. So community labs are part of our healthcare system, Speaker, and that's why we're continuing to work to improve access or maintain access to those community labs. So, Speaker, in the supplementary, I will happily speak more about some issues that are important to people.
Minister, it's not just residents in my community that are facing reduced access to laboratory services. Since your government came to office, close to 60 labs have closed across the province, and a further 15 have reduced the services that they offer. Half of these reductions in closures are in rural and northern Ontario. I'm hearing from physicians whose patients don't have access to lab services anymore. These same doctors can't diagnose and treat their patients appropriately as a result. The province-wide contract with lab service providers expired on March 31st, as you know, and you seem to have been doing nothing on the issue since. Minister, will you commit to review the system and bring in real competition to ensure that Ontario's patients and taxpayers are getting the services that they need and the value that they deserve?
Speaker, as I said in the initial question, this is an issue that we are currently very much engaged on. But, Speaker, I think the people of Ontario have another much bigger concern, and that is the future of health care in this province. Speaker, you know that we've had concerns about the plan of the people opposite. One of your newly nominated candidates, the Kevin Gaudette in Pickering Scarborough East, is quoted as in an op-ed in the National Post said, Mr. McGuinty should instead look to alternative delivery models, which include greater private sector involvement, because no amount of new cash ever seems enough under our current healthcare monopoly. Speaker, another quote, there is no good reason that hip replacements and cancer care can't be equally insured. That's private insurance. This is Kevin Gaudette, your candidate. My question to you, Speaker, through you, Speaker, is do you agree with your candidate in Pickering Scarborough?
New question, Leader of the Third Party.